I'm Victoria Stanton. I'm the Director of Development and Engagement at Safe Voices. Safe Voices is the Domestic Violence Resource Center serving Androscoggin, Oxford, and Franklin counties. We've been doing this work for about 44 years, and we provide comprehensive advocacy and emergency shelter for folks experiencing domestic abuse and violence, sex trafficking and sexual exploitation, dating abuse, stalking, and elder abuse. We also provide comprehensive safety planning, support groups, prevention education, and other kinds of educational work out in the community. So when the pandemic happened and we were faced with transitioning to entirely remote work for our team, we were fortunate enough that some of our core services already were structured to be remote, and that specifically was our 24-hour helpline, as well as our web-based chat services. And so the transition to being accessible, we had some pathways forward, but we had some unexpected challenges with, bringing our staff up to speed with the technology they needed to be able to connect with folks one-on-one, perhaps over Zoom meetings, how to connect and collaborate with our partners in the criminal justice system, law enforcement, things like that. And so like many other organizations, we ended up with some unanticipated costs to be able to outfit our teams and keep them working and keep them responsive to do the mission work, because the needs amongst survivors certainly didn't change. If nothing else, we did actually see some increased volume of activity. And I'll say more about that in a moment. But this grant opportunity with Healthy Neighborhoods was, just such a wonderful piece of support in making sure that we were able to outfit our teams appropriately, keep our staffing whole so that that 24-hour response could stay in place. As far as, things that we use the grants for, again, just bringing people in to a remote work environment, and then covering some of the costs of increased dispatching. One of the things that we experienced was about a 20% increase in call volume from people seeking support on our helpline, and we pay per call for that dispatching service. And so you can imagine that added up. But we were really proud to be able to stay present and supportive through that time. We served about 500 people between April and June through a combination of services and access points. And speaking specifically to the community-based advocacy that we do, we were hearing a lot of things from survivors about just the increasing risk and instability that they were experiencing. A lot of people have been talking about domestic violence increasing during the pandemic, and what we've seen is that it's not increasing. It's always been a pandemic in its own right, but that the situations people are in feel more dire and require more creativity with the safety planning. So some of the things that we learned, first and foremost, I just want to affirm that, we learned and really had underscored for us what we've known for a long time, which is that survivors are tremendously resilient and create their own safety planning and how they keep their families and themselves as safe as possible in really challenging situations. And that there were factors specific to the pandemic that specifically increased risks. A lot of folks are aware people are spending more time in their homes, potentially with abusers. It's harder to reach out for supports. Because of the pandemic, people who had maybe been assaulted or needed other kinds of medical care were hesitant to access medical care, for fear of exposure, and abusers knew and kind of traded on this. Children in the homes, we had some people reach out to us who had shared custody arrangements with their abuser, and that person, as a tactic of abuse, might have been refusing to socially distance or use masks when the child was in their custody and out and about in the community. And so things like that we help people navigate, as well as just the fact that so many more people were experiencing hardship with job losses and layoffs and things, that the normal safety nets and assistance programs that we would be referring people and connecting them to were definitely strained. And so getting access to some of the things that I think we all, have been used to using and used to having available were maybe less available than they normally would be. When we asked survivors, we surveyed them over our helpline. We asked them specifically, if they were experiencing increased risk as a result of the pandemic, and 70% responded that they were. But what was encouraging was that of the people who connected with us through our helpline services, more than 90% said that they were able to achieve more ways to plan for their safety. And they had a better sense of what their options were after connecting with us, regardless of the fact that we didn't get to connect in person.